Welcome to That's Inclusive, where we talk about disability and what it means to live a full life engaging in our communities. What does that look like, and how can we work together to make our world a more inclusive place?
Hello and welcome to That's Inclusive podcast, brought to you by the New Hampshire Council on Development of Disabilities. Today our topic is going to be inclusive and accessible recreation. My name is Chase Eagleson. I'm the Policy and Planning Coordinator for the New Hampshire Council. With me I have
Steve Workman, Director of Transport New Hampshire.
And
Ryan Donnally, Advocacy Coordinator with Granite State Independent Living.
It's fantastic to sit down with both of you. As we discussed before, you guys haven't met before, but it's great to bring people together. So I guess we'll just start right off. With New Hampshire being a state that's notoriously difficult to reach out to residents, and not a lot of people want to enter surveys, emails, phone calls, door, anything. What are your organizations doing to ensure that the transportation services and resources already accessible and available to Granite Staters are both widely known and used? Either is welcome to start.
Sure, well, I can go in. So Granite State Independent Living participates on the State Coordinating Council and Regional Coordinating Councils to develop our operating structure and advance opportunities for accessible community transport. And in addition to that, we also work very closely with the statewide Independent Living Council, which in fact I'm a member of. And one of our priorities for our upcoming 3-year state plan is a focus on really getting the word out on what services are available and addressing any issues that folks are running into with the services that we have in the state.
That's fantastic, Ryan. Steve?
Great. Yeah, I think I'd like to start by following up on some of the two bodies that Ryan referred to. So our State Coordinating Council for Community Transportation is a statutory board. It's appointed by governor and council and then by statute to have representatives from state agencies in addition to stakeholders around the table. I actually serve on that council, and I'm the secretary, so I'm part of the leadership for that. So that's the macro level at the state. However, we need to also bring that down on the ground into what we call our community transportation regions, which is basically how we've carved up the state into 8 regions to make it more manageable. Each one of those regions has a regional coordination council. And the way this is supposed to work is up at the macro level at the State Coordinating Council. We are thinking about coordination. We're thinking about policies and trying to address needs and help remove barriers. We're also really focused on trying to bring state agencies together because not one state agency holds all of the funding or responsibility for providing transportation services. So right there, you can see that we have to speak. We can't remain in our silos. And then after that happens, that flows down into our Regional Coordination Council because this is where the rubber hits the road, so to speak. So this is where our providers are. This is where local community members and local service providers, non-transportation providers, exist. They know what's happening in their communities and where the needs are and where the gaps in services exist. So at that level, we get a lot of feedback on how things are going there, and there's a lot of recruitment to bring people to the table so that you can solve things for your region, and then that flows up to the state so that we can figure out how to facilitate that. So within that structure, you have my organization, Transport New Hampshire, and I do a lot of advocacy, but one of the things I try to do is build coordination and pull folks together across agencies, different stakeholders. As a result of the work that we've done, particularly over the past 4 years, we've been able to transform how we deliver the services. So 2 of the services that I think are most critical that we get out into the community, both for the professionals that are providing services, but also the general public, is our Keep New Hampshire Moving website. We just launched that in June 1st of this year. It is the first time New Hampshire has ever had a single website with a searchable database for transportation options. So that includes things like buses, volunteer driver programs, paratransit services. There's stuff in there about air and getting to our airports and our intercity buses. And that's a stop where people can first learn, because unfortunately there's a lot of jargon in our industry. And sometimes because of funding and policies, you have to call it what it is, the jargon. Yeah. So instead, what we've tried to do is first educate folks so they can learn about the different types of services and how they're delivered and whether there's an eligibility requirement. And then there's that searchable database component. And the most important thing, or the best filter I think that the public can use, is the where do you live? It's a drop-down filter where you can put your town. And this now shows you what services are operating within your community. Then you can do a further drill down for that. So we've just started to really push that out there. So we're making a big effort to train providers. So these are state agency folks. These are other service providers, healthcare providers, education providers, so that they know the resource. We've worked with things like CareLink and 211 so that they understand that we now have a database that is kept up to date regularly. And that is the place to find the most current services. We're also really embarking on trying to get the word out to the public now. And so this is where we're looking to municipalities, different service provider agencies, to make sure that they link to the site Keep New Hampshire Moving. It's the name of the site. It's also the web address. So it's keepnewhampshiremoving.org. The last thing we did, and these are two big accomplishments that happened almost simultaneously, is that we put in a statewide mobility manager network. So what is a mobility manager? A mobility manager is like a social worker or a case manager that you would find in other sectors. And they're there they have multitasks, but their first thing in terms of helping the public is to help people find transportation. Now, it's a tall order in New Hampshire. We're going to unpack that a little bit later. But those two resources we feel have been our biggest step forward in quite a long time, and we have plans to build upon those successes.
That's awesome. I mean, I was at I don't remember what month it was, but the SAC meeting when they first started talking about Keep New Hampshire, or once it was released, Keep New Hampshire Moving. And I was kind of astonished because I was just kind of getting into the disability world. I hadn't spent that much time in it. All the complaints I heard was, I can't get transportation to this, I can't get transportation to that. And then knowing that there was this huge, vast supply of transportation, we just, as I said in the initial question, people just didn't know where to look. And there it was. It was fantastic.
Well, I can take it one step further. When our mobility management team, so each of our regional mobility managers and our state mobility managers were working with me to create the inventory of services, we were surprised at how many there were. So that just tells you how we had our services were fragmented or sort of patchwork, and we needed to do better. And this was really step one.
Oh, I congratulate you on that. I mean, I've been on the website. I'm sure, Ryan, you have too. It's exactly what I was looking for. I'm sure exactly what a lot of Granite Staters were looking for. It's beautiful to see.
Thank you. And we have plans to make that better. There's still some content on the site we're continually updating. And of course, the key is making sure that the contact information about the actual transportation provider stays current. Otherwise, it's not worth.
Yeah, no, makes 100% of sense. Again, fantastic to see. I grew up in New Hampshire. I'm from Hampton. I've been here my entire life, and pretty much my entire life has been stuck in the same area because I didn't have a car for a while. So it was a lot of just, I don't have anywhere to go. I can't go anywhere. And I'm sure a lot of residents, especially up in our northern sections where there's not a lot of very populated areas, don't see a way to get down south, a way to get to the State House to advocate is, I know Ryan's always there and I'm always there. And Steve said you do some advocacy too. I mean, it'd be great to hear from the voices up north, and I think this is Keep New Hampshire Moving is going to have a huge impact on that.
It would. We know that there are people in need of these services throughout the state. And of course, we're a real rural state. Even with our urbanized areas, they're still smaller than a lot of the larger cities you see throughout the country. And so the challenge is inherent in that. It's not feasible to say that everybody is going to have a public transit bus service like we down on the coast. I grew up in Portsmouth. We have Coast Bus down there, and throughout there's Manchester Transit, Nashua. Up in the North Country, though, the transit agency, which is through Tri-County CAP, that actually looks a little different. They carry out many of the functions of that, but it's on a smaller scale. So you'll see shuttle buses that will go through instead of the big traditional buses that people might think about. And That's a tall order because your distance around things, especially when you drop the White Mountains in the middle of everything, your distance for trips is crazy. So folks are happy when they can connect with basic needs. But then when you talk about the advocacy work, and Ryan, we know how important it is. If you and I show up all the time, we're going to become that old familiar face. We need constituents to come and advocate for themselves and figure out fundamentally, how do we get them there first?
Absolutely. Because, the more people who are there, the more stories that can be told will be all the much better for advancing our mission.
Yeah, I always tell people they really don't want to see us. The legislators, they don't really care to see our faces that much anymore. I've probably been yelled at too many times, and I've yelled at them too many times for them to want to look at me anymore. So it's great to have new faces, great to have new stories. It really just adds to the impact that we all need to see.
Absolutely.
And
Absolutely.
on to that access and availability thing, medical transport has been a hotbed issue in New Hampshire as of lately, especially in the rural areas where there's really nowhere to go unless you have an ambulance, and ambulances are private providers, and they can be very expensive. It's been pointed out that transport through Medicare in particular is not very well structured to support the needs of the Granite State disability community. What are some ways that you believe we can better the system? Either one of you can go on, Ryan.
Yeah, I mean, Medicare in particular is such a challenge because, if you have a medical emergency and you need an ambulance, that's fine. That's one thing. But any kind of other transportation, like non-emergency medical transportation, Part A doesn't cover that. Part B, maybe, but only if it's deemed medically necessary through a doctor's order. If you're on Medicare, you really need Part C or a Medicaid Advantage plan, and have to hope that whatever provider you've signed up with offers that as a service. And if not, then you've got to explore other options, and that's tough. So so I think services and resources like Keep New Hampshire Moving are going to be a big help in kind of filling that gap and informing us on where we can do better in that area. Especially
since we know that, with non-emergency medical transportation, a lot of us need just to get to appointments. And if you don't get to those appointments, eventually it becomes an emergency. Eventually you need those appointments, and now you're paying out of pocket for medical transportation that if you had just gotten in the first place for reduced rate, whatever, you would have been probably fine.
Yeah, and I'd take that a step further. We're talking about non-emergency medical transportation right now, but we have bought in, as a transportation sector, we're educating ourselves. We've started to realize it's not about just operating buses on time. It's really about the consumer. So part of our switch and our addition of mobility management, we adopted a philosophy of mobility management, which is person-centered. Now, that's going to be a term that's going to resonate through other sectors. In the healthcare sector, they'll use a similar term. So if we're serious about person-centered, then we have to do better. So looking at this particular issue, so there's things like social determinants of health, and those are important recognized measures nationally that help us understand how someone is surviving and hopefully thriving. And so just getting to a medical appointment is not good enough. What about healthy food? Or what about social activities? We have found that isolation, particularly for the elderly, but anyone that feels that in a sense that they are trapped within their home, we know this is a deficit. And so we have to broaden these service deliveries to look at the whole picture. We can't just sort of cherry pick and say, well, if they get to a medical appointment, they're going to be fine. Well, that's critically important. But if you wouldn't mind, I'd like to get a little nerdy around this topic.
Go ahead, please.
So New Hampshire is not alone. I also have had the privilege to work on the national stage with the National Center for Mobility Management. I work as a consultant with Easter Seals National, who holds part of that Technical Assistance Center contract funded by the Federal Transit Administration. So one of the things that's happening at the federal level, and listeners, please stick with me because this is important for you to know as you become your own best advocate. So at the federal level, there's something called CCAM, which stands for the Coordinating Council on Access and Mobility. Earlier, Ryan and I spoke about the State Coordinating Council here in New Hampshire. That is the state's version of CCAM at the federal level. But what CCAM does is it brings all of the federal agencies that have a piece of transportation service delivery and funding together. And their purpose is to remove policy barriers, to streamline braiding of opportunities for braiding of funding so that you're not, for example, reporting out to 7 different funders, reporting out to getting licensed, where one program will say, well, you need these licenses, and then another one will add one on top of that. It's a myriad of issues that we don't have time to unpack in this episode. But one of the most relevant things is the issue of non-emergency medical transportation. And so CMS, which stands for the Centers for Medicare and Medicaid Services at the federal level, they hold the lion's share of transportation funding, and that's specifically through Medicaid. But CMS is represented on CCAM, and there has been a lot of work done between Federal Transit Administration and CMS to actually look at how transportation services are being provided across the country and how they're being funded. And so 2 critical things have happened within a year. Last October, CMS issued a guide to all states that was really doing a deeper dive into delivering transportation services. And it looked at areas that have been barriers for our transportation providers. I'll give one example. There's something called no-load miles. Essentially what this means is you were able to bill and get reimbursed when you had a passenger in the car. The problem is that you're often dropping a passenger off and then returning back to your facility. And those are unloaded miles. Well, down in the urban areas, that's an issue, but it's less of an issue because the density. But when you're talking about the North Country and the more rural areas, then that is a significant cost. Well, who is paying for that? The transportation agency has to absorb that cost. So this is just one example of how that guide that was issued reminded states to take another look at what is allowed. And this is where you can actually reimburse transportation providers for no-load miles. And again, there's several other things that you can drill down in there. But why is this relevant? Because here at the state level, we still have that CMS component. So for us, it's located within the Department of Health and Human Services. And I know a lot of the folks there. And Ryan, I'm sure you've met with them and spoke with them many times. And we acknowledge that we have to work together better and that there's a need for continual improvement. And I think they're starting to do some really interesting things, not just with the Medicaid, Medicare, but things that connect to that as well. But what we need them to do is really engage in conversations with us at that macro level. And the thing is, we have the ability to do that. We have the State Coordinating Council. We have representation from DHHS, which is fantastic. But we need to drill into this a little more and have discussions about what is the federal government saying is allowed. What would that look like in New Hampshire? But let's be fair. This is a scary program for people that administrate it because there's been no end of the discussion of fraud nationally on the political level. So you have to understand that when you have state workers or even at the federal level who are trying to manage these programs, and then it goes down to the provider level, there is fear of being audited and found out for some unintentional fraud. What I have found in listening to stories throughout the country and then here in New Hampshire is that this can sometimes cause paralysis. No one wants to actually pop their head up and suggest that maybe we adjust things or try something a little different. I think we have to work with that. I think we have to respect where our state employees are coming from and the circumstances they're working. But we also need them to come to the table to have these harder conversations because if you and I stay in silos, you and I are never going to build a relationship. So why should you trust me? You don't know who I am. But if we agree to come together and work through these issues regularly, suddenly we're building trust. And it doesn't sound like I'm just trying to steal some money from this agency to put it over here in this agency. No, again, person-centered. So for folks that want to nerd out like I do about this, I would recommend that you actually go to the Federal Transit Administration's website, and you can do that by searching FTA space CCAM. So Coordinating Council on Access and Mobility. And that will actually bring you to their information page. And you can find out more about how CCAM is trying to braid efforts across agencies. And also you can click through and get some great fact sheets, because just 2 weeks ago, FTA and CMS issued a new coordination fact sheet, which I have right here in front of me, which we're unpacking. And here's the last thing that makes me proud about my sector. I am finding across the country, it's the transportation providers who are actually picking up the banner and being the ambassadors. They're knocking on the doors of their colleagues at state agencies and saying, can we talk about this? And are you aware we have these opportunities, and it is totally supported by federal code and state code? We just have to make sure we understand that.
That's amazing to hear that so much work is being done to actually push this forward. I've seen a lot of times when, the job gets done, but, actually getting it out there available sometimes gets a rocky road, because some state agencies don't want to do it. Some state agencies don't want to give up their funding for different things, but it's great to see this actually getting done.
It is. It's, I understand when the consumer hears these things and says, but I need help right now. And I will assure you, my colleagues at transportation level, no one likes to say, no, we can't accommodate your ride request. But it's the reality of where we're working at. But unfortunately, government moves very slowly, and it's massive. I mean, it's like a barge. A little course correction can put you miles and miles off course from where you set out. In this case, we're trying to nudge the system and to actually adapt this. So my message then is, I understand your pain to the extent that I can appreciate it. I am not in your shoes, but there is progress out there. And if we support the agencies and the decision makers that are actually trying to create these environments for this to happen, then it allows the system to pick up speed and this change to happen quicker.
I agree completely with that idea. On the macro level, small changes can make huge impacts, and we need to keep making those little nudges to the correct side. But, on the micro level, as you said, people are having issues now. And, things like being in the community is a big part of it. You talked earlier about how transportation can really, for non-medical reasons, can really help you be part of the community, be part of, any community you want to be part of, but kind of feel like you belong, which is extremely important. And now, Ryan, I want to direct this one to you. GSIL offers a wide variety of services to ensure that individuals living with disabilities are able to access the community. Could you talk about the importance of not only community access, but community inclusivity for individuals living with disabilities?
Absolutely, because it's so important, not only for people with disabilities like me, but everybody, really, because, I think the disability population is a population that oftentimes isn't seen and, frankly, can be forgotten about. But we're here. We're people. We have hobbies, interests, goals, desires, and, nobody wants to be stuck at home all the time. Want to be able to go out, have fun, catch a movie, grab a bite to eat someplace, whatever. And so I think just, being a part of our communities, being out there and getting everybody used to seeing us and realizing that we're a part of their communities as well is so important, for things just, like reducing stigma and all that, and just raising awareness in general.
I agree completely, Ryan. One of the things I've heard, in my years living in New Hampshire a lot of times is, why do we need this accessibility thing? I don't see anyone in my community that needs it, but it's because you're not really looking. You can say you don't see anyone, but one of my favorite sayings is, you either have a disability, you're probably going to have one within the next 10 years. Age brings disability. Anything can bring disability. You can be born with it, but eventually someone's going to need help. someone's going to need just a little bit of access. And it's not that much to ask for.
No, and I can't count the number of times where there's been an accessibility issue in a small town maybe somewhere, and nothing's ever done about it until somebody speaks up, either that person with the disability or a family member, and the town realizes, oh, well, this is a problem, isn't it?
Yeah, I mean, I will say sometimes it's just not people's fault. They just don't see it from that angle.
No, and certainly not to cast blame. It's
No.
that's just how it is.
Yeah, but I will say, I mean, again, growing up here, I've said this about 12 times at this point now, but I was like, as a kid, didn't see that many people with disabilities. But again, that was because they just didn't have a space. It seemed like, I mean, a lot of people seem to just be pushed out. Just so weird to me now that I've kind of, grown up and kind of gotten more of an idea about the community. It's so odd to me. I mean, even in the past 25 years, we've seen huge increases in community inclusivity and acceptance. But good thing is, it seems to continue to be rolling forward in the best way possible.
Yeah, this makes me think of an adage that I know many of my colleagues, especially within our regional planning commissions, think about. But if we were building our communities thinking about aging, right there, you would find communities, you would see things like curb cuts and specialized signals and things that would make it safe as just one example. So if we could do more of that, then you find, because I know there are unique needs between somebody that is working with a disability and, say, someone who is just aging. But the solution to a lot of those things is the same thing, and it's often good infrastructure, good planning to think about these things. Don't drop a housing complex in the middle of nowhere and without planning for some form of public transportation that would work. Don't expect people to make it to a bus stop if there's no safe sidewalk. I mean, those are things, if we just approach those in the day of doing business, we'd find some of this stuff would take care of itself. And then folks that have been challenged and often been stuck at home or isolated, they know what they can do. They have the energy. They can get out and take advantage of that.
Yeah, I mean, I think one of the best examples I've seen of that, and curb cuts actually comes to mind, is curb cuts aren't only great for people with mobility issues. I mean, parents that have strollers, people with bicycles. I mean, a lot of people can use curb cuts, and that's just one example on how an accessibility issue or accessibility accommodation can really benefit a lot of people in ways that it seems not to be talked about for some reason.
So there's a term for that, and that's universal design. And that's something that we've been pushing for very hard, especially with our housing crisis that we have in New Hampshire. Because, boy, you talk about curb cuts, that's one thing. But trying to find a place to live for somebody who's in a wheelchair in New Hampshire, that's tough.
Right.
Especially with historical housing modifications, there's allowances with that. I mean, a lot of places just, I don't want to say they don't care, but it's just not, on the top of their list of things that they're really looking at. But really, people want to age in place. Another great saying, which is, again, as you said earlier, person-centered planning. If you plan for them to age in place, you're planning for universal design, universal accessibility. It goes on a really nice, easy track.
It does. I mean, we're retrofitting old New England towns. That's challenging from a road perspective because they were all built off of basically horse paths, maybe a cart path if you're lucky. But the point is we could do this. We have really bright people in our state. And we have people at the local level that understand where the needs are. But, we've got to take this one step further, and we'll just keep working the curb cuts. It's not enough to just design them now. Yes, they have to be maintained, but we have something coming up called winter. And I am very saddened when I hear this, and I hear it frequently. And that is somebody says, gee, there's such a nice job being done to plow the sidewalks. And I can actually get out. And if you're in a motorized chair or you just want safe walking, you're an older adult, you want to be on something. And we hear people being so happy that local municipalities have really looked at that and they've bought the right equipment to do it. And then you get to an intersection. and suddenly there is a 2-foot, 3-foot pile of slush and ice and snow preventing you from going any further. But it's almost like when you were sharing about how you didn't see folks as you were growing up, you didn't realize. I don't think anyone's doing this deliberately. Yeah. Our plow people, they're not doing this on purpose, but it's a matter of you don't understand the implications. So this is where at every level of government, advocates need to come forward and to talk about these things to remind them so that that kind of change can happen.
That's a fantastic point. I also want to applaud our Department of Transportation for the plow guys, because I've been to different states and they do not do it as well as we do. That might just be a Granite Stater thing to say, but
we've got skills.
It gets done far quicker here, but yeah, I mean, it is the little things that if it was just those thought about or those done, again, not their faults, just not something that's on the top of their brain. But I mean, if we get it there, I mean, there's a lot more people that can get access, a lot more people that can be part of the community, and it's not like they don't want to be. That brings up a big point, because, I mean, we've been talking about all the stuff we want to do, and a big barrier to that is money. I mean, we're in New Hampshire. Most people don't want to spend money, which is fair. But funding aside, what is one thing transportation-wise you would implement to ensure that individuals living with disabilities are able to fully access their communities?
I really think collaboration is going to be the key to figuring that out. And the regional boards and stuff that we have here, the work we're doing with the statewide Independent Living Council and all that, that's really going to be key to figuring that out. Funding is definitely an important part of it, but I think really nailing down the resources that we already have that are available through websites like Keep New Hampshire Moving, I think that's the way to go.
Yeah, I love when I hear other people point to coordination. That is the only way through. It's better together.
Thank you.
And so I'm not known for brevity. So my one thing is actually like 3-ish, but I'll be quick about it.
Go for it.
So the first thing is I mentioned the Keep New Hampshire Moving website was the first iteration. In a perfect world, and I believe we can do this, and it's a matter of will, and yes, it will cost money, but actually the willpower piece, the desire to come together, is we need a system statewide that is one click, one call. Right now, when you go on to Keep New Hampshire Moving and you find some providers that you think might work for you, you have to click through to an email or call them, and then you pick that up. Now, that's for one trip. Now, imagine the folks that need to go from the North Country to some sort of specialized center. Think of the folks on dialysis who have to travel. In some cases, we have clinics closing up in the Vermont area and things, and this is putting a strain on the system. So oftentimes, in addition to being at a clinic for just hours a day to be dialyzed, you now have to throw hours of transportation. Well, our system is not set up that the same mode you get on, the same bus, if you will, is going to take you all the way to the North Country from the coast or vice versa. So this means we have to switch providers. Well, to plan your trip, we need technology that can connect all of those providers and they can talk, and we can do this. There is now a technological standard that would allow these agencies to keep their software that they're using, but there's a standard that can be implemented that allows those to speak to each other from a call center, which now means a consumer could go on and book a full trip. Related to that is a common eligibility application. Each agency, and this happens for a number of reasons. It was not intentional for people making lives more difficult, but down in Region 10, which is on the coast, that region created what was called a Common Core application, and it streamlined the process. So for the consumer, you weren't filling out a bunch of different application forms or doing a bunch of different interviews. They decided what data really was needed. You complete that data, and then it gets shared appropriately. And of course, all of this information is protected just the way you would expect it to be. But this just improves life for the consumer. So I really think that's the next frontier technology-wise that we should be moving. Next is we have to close the gaps in service. We have too many gaps in the state. So this is what's going to, unfortunately, as folks try to book rides, I can almost guarantee that one of these times you're going to hear the word, "I'm just sorry, we can't help you at this time," or maybe it's a permanent gap. So we've got to do better about that. And then finally, this is a shout out to our policymakers. And we have, Governor-elect Ayotte who's coming in. We have turnover in the Senate and the House. These folks have the opportunity to create the environment for this to happen. Now, yes, they control the purse strings, and I will give a shout out to the bipartisan support. We've seen an increase in funding come to support our transportation services through the legislature, and that's a tough decision given the financial picture in our state. So there's already an understanding at that level. But what I'm encouraging them to do is to think bigger and realize you need to create the environment and the mandate for your employees and the state agencies and say, we expect you to reach across sectors, to coordinate and to find those opportunities, and then allow people some flexibility to try some innovative things. Sometimes things don't work, and we can fix those. But without our leaders expressly making that part of it, it's not going to happen just by itself. You will have a few people that rabble-rouse and really want to try to reach out, but by and large, the system will sort of stay in those separate silos. So those are my 3 things.
Well, I gotta say, both those are fantastic ideas. The technology thing got me a little giddy. That's that's one of those things. In 20 years, people look back and say, "You had different forms." It's such a waste of time,
right?
I will tell you, as a person with a disability, I love the idea of having just one common form to fill out for eligibility. Because, boy, I've signed up for a lot of stuff, and it takes a lot of time and a lot of work.
Yeah, think about it. Why are we doing this? Why do our government exist? Why do transportation provides healthcare? It's all about delivering the services to our residents, to our consumers. So I think that should be a lens that we apply, where we look and say, why are we doing this, and who is it benefiting ultimately? Is it benefiting the bureaucracy and the system and just perpetuating the way things had always been done? Or is it actually making meaningful change that positively impacts the end user?
What a great statement right there. So I'm actually going to let you keep going.
Okay.
So, Steve, I would love just this end section to allow you, with whatever time you want to take, talk about some of the accessible transportation programs that Keep New Hampshire Moving has to offer throughout the state. Along with that, how can people use those services, provide feedback and accessibility, safety, comfort, etc.?
Sure. Well, first, I'm going to start with our providers, because Keep New Hampshire Moving is a clearinghouse. The magic happens with our providers that come to the table and deliver these services and work every day to keep our buses, our volunteer driver programs going. Shout out, by the way, to volunteer drivers. Without them filling the gaps, we would be completely dead in the water. So if you're hearing this and you know of folks that might be interested in becoming a volunteer driver program, go to Keep New Hampshire Moving, reach out to us. We will connect you with a program in your region. The more drivers we have, the more effective program that will be. So that's my tangent on volunteer driver programs. But in terms of other providers, I work with fantastic folks. Like I said, they don't like the no word, being able to say we just can't accommodate a ride. Now, that may not always be in the harried process of booking rides. You may not feel that warm and fuzzy coming back at you from the line, but I can assure you when I work with the leadership from these agencies that this really bothers them. So within that, though, if you go through our provider list, and I'm going to highlight just a couple of big ones, but there is accommodation. So anyone that is receiving public funding, and this would be both federal pass-through dollars and then any state dollars that may go into the mix, there are requirements to make sure we're maintaining accessibility and providing for the other needs of a myriad of potential riders. And so they're doing that. Others, we have Easter Seals, for example. They're working out. They have a lot of facilities. Granite State Independent Living, Ryan, of course, runs a fleet and is critical. They're accessible vehicles.
Absolutely.
So they exist. When you go on to Keep New Hampshire Moving, if you are doing that provider search, we did one thing because we knew that wheelchair accessibility was really a critical piece. So when you get this little return on your searches, it comes up, each provider's in a little box, and there's a bubble that comes up that will say wheelchair accessible. So that's just one small way that we tried to cut to the chase for folks that are looking for accessible vehicles. So this is great. One of the issues, though, is not all providers out there. So we know we live in a day of Uber and Lyft and taxis, and these are part of the solution. However, a consumer needs to know who they're getting a ride from. They have to understand, do they have accessibility? Do they understand the needs? I have heard horror stories that have broken my heart where somebody who is working through some sort of a disability, one of the biggest stories involves somebody who was in a chair, and basic dignity of that individual was not preserved. That's unacceptable. We can do better than that. So we need to make sure that while we're looking to close these gaps, that we're actually finding providers that truly understand what they are providing. Because this is not, I want to go out to dinner and I need a ride home after a night of clubbing, at the bars or something like that. They need to understand that if you're providing these type of rides, it's a whole different world, and you need to step up to that challenge. So that's the difference. I'm a big proponent of our publicly and charitably funded providers, and we have a bunch of for-profit providers. For-profit is not bad. What you want to make sure is that they fully understand, and they've been vetted, and they're trained, and they understand the issues and are held accountable. Another thing is a project that is specifically under Transport New Hampshire, and you can see nods to this on the Keep New Hampshire Moving website. At the bottom of every page on the website, there is something about, I forget what it says, it's something about your user voice, click here and sign up. So Transport New Hampshire, because of our advocacy role, is creating a consumer voice pipeline. And so I'm hoping that this will move. We have the infrastructure in place. My website, which is not live right now, has actually been restructured and is waiting as we're building out the rest of this. But essentially right now, users can click on that and they can sign up. And that we're trying to create a two-way dialogue so that we better understand what are the issues out there. Now, I want to caution two things to anyone hearing this. This would not be an emergency hotline. This would simply be a way to bring consumers together and elevate their voice, and also share information with them that might be relevant. The second piece is that if somebody believes that their civil rights have been violated in any sort of way, or a situation they had with a ride experience was just really critical, that goes directly back to the provider. And I will tell you that all of our publicly supported providers, they are responsible for this. And if you go onto their websites, it will talk about if you need to file some sort of a report and contact them. So yes, you can talk about experience generally through this new New Hampshire, Transport New Hampshire consumer voice pipeline, but it will not replace the need to interface directly with an agency. And certainly, like I said, it's not something set up to be responsive to, I need a ride or I've been left somewhere. So I think this is going to help, and we've covered a lot of ground. And if we can move those pieces forward, continually improve the website, move toward more of a one-click, one-call situation, a common application, and if we can keep communication and coordination lines open, adding that consumer voice is only going to help. And the other thing, while we've been building these relationships across sectors, when I talked about getting information back, I really do see this consumer voice as a two-way pipeline. So I expect there may be opportunities with my partners at DHHS, for example, in public health. There could be relevant information that we are trying to get out in front of the community really quickly. And so we're creating this system then. So again, right now, consumers can go on the site, go to the bottom of one of the pages, click that link, and you can put your information in, and I will assure you that nothing will happen for a while. But as soon as possible in the coming year, I'm hoping to have that up and going where we start making communications and we start really trying to figure out what that consumer voice piece is going to look like as it matures.
Well, I can say I've checked out Keep New Hampshire Moving. I said earlier, Ryan said he's checked out. I know a lot of people have checked out. I have only heard positive things, which for New Hampshire is seemingly impossible. But I mean, again, I agree. And I'm going to reassure you, this is going to make a good impact because I've already seen it make a good impact, just even emotionally on people. The idea that it's out there and that someone's trying and it's actually trying well has been great to see. And I applaud you.
Well, I appreciate that. On behalf of our entire team, our mobility management team, our coordinating councils, both the state and regional, we worked hard. This was really, at this point, this was a 5-year planning process. That was not pleasant, just simply because it took time. But we had to work through a lot of issues, and we've got more issues to go. And then sustainability. But I really appreciate being able to bring that type of feedback to say, people are noticing our efforts. Let's build on that.
Oh, they're noticing. And I will say it's, again, surprisingly all positive, which is amazing.
Excellent.
Well, Steve, Ryan, thank you both for being here. I'm sure this information is extremely helpful for people, and it's always great to see both of you. This has been That's Inclusive Podcast. My name is Chase Eagleson.
With Steve Workman.
And Ryan Donnally.
All right. Thank you.
Thank you.
Thank you for joining us today. I'm Vanessa Blaze, and this was a production of the New Hampshire Council on Developmental Disabilities, produced by Isadora Rodriguez-Legendre and Vanessa Blaze, with many thanks to Josh Hardy and the rest of the crew here at Concord TV. We love to have guests with differing perspectives. These views are personal and do not necessarily represent those of the DD Council.